joining me for the first time, I welcome you. And if you haven't subscribed to my channel, don't forget to press the notification bell so every time I upload a video, you will be first to be notified. Today, I'm going to talk a bit about the Osce exam. I mean, there probably other videos, but nevertheless, I'm just bringing my personal experience to you. And for those of more or less for my Caribbean nurses who wants to come to the UK to become a registered nurse. Okay, so I'm just giving you some of my personal tips and tricks in how I pass my Osce and some of the things that are entailed in the Osce. So Osce is an objective structural clinical exam, and this exam is done in the United Kingdom, and you come to the United Kingdom to do this exam after it's more or less a final stage. You must do this exam no matter how many experience you have. You must do this exam, and the cost for this exam is only £950 thereabout. I'm not too sure if it has increased since I took my exam how much months ago. So some things to know about the Osce. It comprises of different parts. So you have the nurse. So first of all, this exam is set up based on whichever hospital or institution you go to work. They normally set up your, make the appointment date for your exam, and they also give you that support, that extra support to help you to pass this exam. Guys, pay attention. All of the information that they give you it helps with your exam. So the Osce, for you to know, it has two sections. They have the API, which is the nursing process, the assessment, planning, implementation, and evaluation, and you have the skill station, which there are 7 skills that you need to choose. 7 skills, which you have to learn, and you only have 2 to do, right? So it's important that you know how you have to do all of these skill station, and when the day of the exam, at least you're prepared and you wouldn't be worried or flustered in any case. I know the thing when you have exam, how you become flustered and worried, but once you keep calm, you will be fine. So in the assessment, I'm just gonna simply break down, because they have one of the thing is that I can't really say much about the exam, but I can just give you, as I said, my personal experience, how I've gone through this process. So you have the assessment. As we know, the nursing process is from the time the patient was admitted to the time the patient is discharged, and how are we going to take care of this patient onward. So you have the assessment phase, where you assess your patient, like everything head to toe based on your scenario. Okay, so based on the scenario that you have, you do your assessment. Then you have the planning phase, where in this phase it's a written station, so you need to do your nursing diagnosis, and you come up with your plan and how are you gonna take care of this particular patient. Okay, and you would write in the present tense. Remember to write. We have the planning phase, where you would have to write it in the present tense, and it comprises of where you have the nursing process, where you would write the things based on that of which you want to achieve for your patient. Then we move along to the implementation phase, where this is the medication phase. So you have the 5 rights or the 6 rights to medication. Now it's about 12 rights to medication. So you have that part where you will be administering your medication to your patient. Completing the nursing process, you have the evaluation. In this station, it's a written station, and you must write it in the past tense. Remember, the past tense. Okay, and this station more or less is everything you would have done from the beginning, when you encounter your patient, to the ending, what you're hoping to achieve. So again, there isn't much I can give, but I could only give you based on my personal experience. Then you also have the skill station, where you would have to do 2 skills out of the 7. So they will let you know the 7 stations that you need to learn, and you learn proper and using the Royal Marsden, you follow the steps in the Royal Marsden and you use that. Also within the skill station, I think each skill station lasts for 15 minutes, some of which can be completed within a shorter time span. Like for instance, BLS, you can complete your BLS within 3 minutes. Then you have, so for the skill station, you have the BLS, you have ANTT, that's the dressing, you have the IM injection, the subcut injection, you also have the peak flow, you have the removal of catheter, and you have the you have urine specimen collection. Okay, so those are some of the, well, those are the skill stations that you need to learn. I can't tell you what to do, but I can only tell you those are just the skill station that you need to learn. Okay, and once you follow the steps in the Royal Marsden and the information that your hospital or the support information that they would have given to you, you will be fine. You will be fine. Okay, so those are all the information. Those are my personal experience. So you know, the like in every setting you have your exam to do, so you make sure to get a good rest. Before your rest is important. Ensure to eat a good breakfast to give you that energy, and you keep focus. Breathe, take deep breaths, you breathe, and you will be fine. Okay guys, so that's all for now. If you have any questions as it relates to Osce, you can drop them below and let me know what you think about this video. Bye.